All right, did you know 1 in 8 women in the United States will get breast cancer in her lifetime? And October is Breast Cancer Awareness Month, so it is on a lot of people's minds. And we talked with Dr. Travis Stork, you know, from the doctors on TV, about some of the myths in this Live Better Now. You know, I guess you can imagine with a disease as scary as breast cancer that falsehoods would come up. So what is a myth when it comes to breast cancer? For one, if you find a lump, then surely you must have breast cancer.
Well, 8 out of 10 lumps that women find are not breast cancer, maybe even more. And so the biggest issue is when a woman finds a lump, which if you're doing regular breast self-exams, that can happen, is to not fear it. I've met so many women who are afraid and fearful, so they'll feel something and they ignore it. But I'll tell you right now, the thing to be fearful of is not getting something checked out, because the longer you wait, if God forbid it is breast cancer, the longer you wait, the more difficult it is to treat.
Now, myth number 2 is that men don't have to worry about breast cancer.
Well, men do have to worry about it. 1,700 men a year are diagnosed with breast cancer, and here's a big statistic: 450 of those will die from it. So breast cancer in men, it's not nearly as common as in women, but if you're a man out there and you do notice an irregularity, you also need to get that checked out, because it does happen.
If your family, someone in your family has breast cancer, then you are a sitting duck. Myth? Real?
Well, 85% of cases of breast cancer, maybe more, are in women who have no family history. But the other thing is, if you do have a family history of breast cancer, that doesn't mean you're going to get it necessarily.